very good evening to all of you who have joined this webinar for MRCP Part 2. I'll just quickly go with the webinar with sharing my slides, and then we'll be diving directly deep into the MRCP, the overview of MRCP, and our main objective of today's webinar. So wait a minute, I'll just share my screen, and then we'll start. Yeah, so I believe you are able to see the screen and my slides. The first thing which comes in the mind are, why have we gathered today? It is because of MRCP Part 2 examination. We'll be discussing, having an overview, and the challenges which usually a student or aspirant encounter while preparing or while attempting MRCP Part 2 examination. And if I talk about what we will be discussing in this particular webinar, today's webinar, the first thing is common mistakes and how to avoid them. Secondly, we'll be discussing what are the changing trends in the recent exam dates. And thirdly, very important is time management strategies, how you need to manage your time in the actual examination, which is very, very critical for MRCP Part 2. It was not that in Part 1, but yes, in Part 2, it is very crucial and very critical. And then the next question comes is, who am I? I'm Dr. Chirag Madaan, the course director at Pastest, and I have helped many students clear their MRCP examination, and will there be for you as well, helping you and guiding you for your MRCP exams. Now, another thing which comes in front of you, or which you might have encountered, or which you might have heard from your seniors, colleagues who might have gone through this journey of MRCP, is MRCP Part 2 seems to be somewhat difficult than MRCP Part 1. What makes it different as well as difficult? The first thing is having challenging questions and very tricky questions. Secondly, along with that, accompanying are the options which are very nearby. So very closely related answer options. That is another challenge in Part 2. And third, what you have are the image-based questions. And fourthly, they are long stem of question, or you can say lengthy questions in Part 2, whereas in your Part 1, you just had 1 or 2 liners. In Part 2, you have lengthy stem of questions with investigation, a list of investigation provided. And then you have to come onto the conclusion, what is the correct one, right? Thinking about whole of the stem, the history and everything, and correlating with the investigation provided. Now you have to go with your answer. Now, I'll be starting, very important topic is, what are the common mistakes, especially for Part 2, and how to avoid it. The very first one is misinterpreting questions. A question comes to you, right? And you have not seen what is being asked in the particular question. Have they asked what is the next investigation or what is the best investigation? So that is very, very important to see and read and focus in the exam itself. So your preparation should be very thorough and efficient while reading the question and practicing the question also. So what you need to do is, how to avoid this problem or the mistake is, you need to pay attention on the patient history. First of all, what is the age, what is the occupation, how the patient has presented. It's not about the background of patient. Let's say patient have a coronary artery disease and you just, they try to complicate the question, giving a lengthy stem. Patient had stenting or a CABG few years back and is on these many treatment, but do not leave or do not skip why the patient presented to you at this moment in the emergency or maybe the OPD. And this is how they start. Patient presented with chest symptoms. So you need to emphasize that, yeah, this is the presenting complaint and what they have provided is the background. So do not just keep on thinking about a cardiac cause because they have given that thing, right? And this is a very, very common scenario, very common thing to happen in Part 2, that they try to complicate, they try to make the questions very tricky, right? And also you need to have an idea about the investigation going forward, that these are the relevant investigation you need to focus on. If the options are provided about, let's say, all the TTP, ITP, DIC, so definitely you need to have an eye over the coagulation profile. You just cannot go ahead with every other investigation, hemoglobin, and then the TLC, and so and so forth, right? KFT, LFT. No, the first thing is coagulation profile. So that is why your approach should be very much focused. You need to know where to concentrate and where to find those clues in your MRCP Part 2 exam. And then the last thing is wording. What have they asked in the last question or the last line? Again, you need to pay attention very importantly is, are they asking next investigation or the best investigation? Are they talking about what is the best treatment or the next treatment? Again, these are the kind of points they usually keep asking and keep confusing, right? In one of the diet, they will ask what is the next one. In the other one, they'll ask what is the gold standard or the best investigation or maybe the best management. Now, moving forward to the second one, getting tricked by the distractors. And very commonly, you have the options in part 2 which are very nearby, very closely related, right? And then you are in doubt. Let's say there's a question about upper GI bleeding, and they ask what is the next management step. The options provided, let's say, are getting a IV cannula instead, or going with antibiotics, or going with the endoscopy, right? Which I believe everyone will think about, and then going with the tamponade effect by Sengstaken Blackmore tube, right? So let's say these are the options. But if they talk about what is the next line of management, obviously your answer would be to have the IV set or to secure IV cannula to the patient. Whereas if they talk about what is the best management, obviously you know banding is the answer. So again, you need to emphasize what is being asked and do not get tricked by these kind of distractors. So my suggestion, my advice to all of you is always read the options which are provided and try ruling out why these are not the correct ones, which is very essential in part 2, was not there in part 1, right? Part 1 was relatively, I would say, straightforward. If you know the answer, you know it. But in part 2, every other question is a tricky one. And with every other question, you need to see all the option provided, right? So with that, I would like to say your study, your approach should be very comprehensive. It should be an in-depth knowledge about a topic. So whenever you are practicing your question, it's not about cramming a question and just going with that question and getting happy or having that satisfactory feeling that yes, you marked it correct and you are scoring, let's say, 70% in your past test question bank. No, that is not the thing. It's not about the question, it's about the topic, it's about the concept. If you know the concept, if you know, let's say, about upper GI bleeding, the whole algorithm which is mentioned, then yes, you are good at it. It's not just a banding technique or endoscopy or tamponade effect. It's not like that, right? So do not concentrate and do not have that feeling and do not have that greed that, yeah, I'll be just going ahead the questions which are given in our past test question bank and you'll be through, right? Please go ahead with the explanation being provided of each and every question. So you need to have a thorough understanding of a topic rather than having that nature of taking the question that, yes, I have done these many questions for part 2, right? Okay, now moving forward, I can see some other queries in the chat box. I'll take care about the queries at the end of the session. Right now, I'll just keep going, right? Because this webinar is for 45 minutes to 1 hour, right? And at the end of the session, I'll try to answer as many as possible. Okay, now moving forward, is the third point is lack of practice with twisted or complex question. And this is what I'm talking about. Now, let's say you have read whole algorithm about upper GI bleed, whole algorithm or whole the management, what are the investigation being provided, what can be the risk factor, everything you have read. But if you have not practiced and you have skipped the question, you try going with the reference book, let's say it can be Davidson or Kumar and Clark's or Oxford Medicine, whatever the reference book you feel, and you are just going with the theory, not practicing the questions. It's absolutely no. It's absolutely a no, right? It's just like a suicidal thing, right? You are not, if you are not practicing question in your part 2, definitely it'll be a very difficult task in the examination. Yes, I would have said yes for your part 1 that yes, if you are very thorough with your theory, with the concept, you can clear part 1. But in part 2, you need to practice questions. That is very, very important. Simultaneously, understanding what is the theory, what is the background about that particular disease or the pathology. Further, the next one is do not skip and do not take these units as a lighter one, right? And what I call it as high yielding topics. Very important are cardiology, pulmonology. I have not mentioned gastro, but nowadays they are asking many questions from gastro. Emergency scenarios, utmost important, very, very, very important in the MRCP part 1 or part 2, especially in part 2, because they gave the clinically related questions. And what they want, the MRCP people, what they want is, if you are working or practicing in the NHS, you need to be a safe doctor. You need to know this is the management. If there is a cardiac tamponade, you need to know, you need to pick up that this is the cardiac tamponade, even without a history. If you have an ECG with you, right? You have the monitor, you have applied the monitor, the ECGs. And with that ECG strip, you should be able to pick up that, yes, this is cardiac tamponade. And this is what they want. And that is why they keep on stressing and they keep on asking about these emergency scenarios, all the emergency scenarios, whether it is the life savings one, whether it is, let's say, all these pneumothorax, cardiac tamponade, these scenarios. So very, very, very important. And then neglecting revision for the weaker areas. This is a very common mistake made, very common. That let's say you are weak in a particular area or particular unit. It can be neurology, it can be endocrino, and you tend to have that tendency to keep skipping. I'll do it later on. I don't have that energy. I don't have that motivation. I am totally fed up and I cannot go with neurology. No, it is not done. You need to give importance equally to each unit. You cannot say that, yeah, these are the good ones, I'll just go ahead with those, and the other ones are the weaker ones, I cannot seat them twice. No. So you have to pay attention equally. And that ensures the balanced preparation. Because every diet, the pattern is somewhat changed. In one diet, they might ask many questions from hematology, the other can be nephrology, right? But you cannot say, I don't like or I don't understand the hematology slides, right? How the lymphocytes or the monocytes and the eosinophils that they look like, I don't understand, I can skip that. And by the way, I'll tell you, so we have this MRCP part 2 course, which I'll be telling you later, where I have discussed all these hematology slides as well. Because if you are going with these kind of rare things, right, and images are being provided, they are the high scoring questions, very high scoring. Because in MRCP, you do not have that one question carries 5 marks, no, nothing like that. It is about based on the equating system. So depending upon the difficulty level of a question, if you are marking a question as correct one, and that has the high difficulty level, right, and being less answered correct by the other aspirants or the other candidates, then yes, that question will carry more marks in the examination. And you will not just clear examination, definitely you will conquer that examination with flying colors. Okay, so do not neglect revision for the weaker areas. And then the last point, I would say the last mistake very commonly done is skipping the images, which are very much relevant, very much important, not from the exam point of view only, they are very much relevant and important from your clinical practice as well. If you have, let's say, a patient with pneumonia, you need to know what kind of pneumonia is it. Is it involving the middle lobe or the lower lobe or the upper lobe? And I mean, what are the other features? Or let's say there's a patient of PCP, how the X-ray looks like, how the CT scan looks like. And this is the tendency you need to develop, right? If at all you are practicing a question, right, and you come across a PCP, you are just reading how the X-ray looks like, how the CT looks like, and let's say in our past test question bank, there is 1 or 2 images attached. But I would say the better is to go ahead on your Google, search for the other radiological images or the X-rays or the CT scan. And I would recommend going with Radiopedia as the first reference. Very, very, very good. Even the questions in the MRCP part 2, they mention in the exam reference or the source from Radiopedia. They have mentioned in the actual examination also. So they take images from Radiopedia. The second source, I would say, are the images which are there in NEGM, right? So the journal, New England Journal of Medicine. Then you can go with images in the BMJ. Fourth, the images which are there on Wikipedia, because there is very, very high probability they keep taking images from these places. These are the four very, very essential. And then if I talk about the derma images, there's something called as derm nets. So these are the ones which you need to pay attention, and you need to keep searching by yourself. Because if that kind of a patient comes to you, you need to know that, yeah, this is the another example of X-ray, or this is another type of X-ray which a patient can present. And definitely it'll help you in your longer run. It's not about just the examination. You'll be able to definitely clear the examination if you are very thorough how the PCP present, what are the risk factor, which are the patients in which PCP can happen. I'm just taking an example of PCP, right, by the way. So there are n number of examples, you all know that. Now with that, so if you are very thorough that this is how an X-ray or a CT looks like of a PCP patient, and these are the investigation I need to go forward. This will be the first investigation, and this is the best investigation. And then what is the management and the prophylaxis to be added? So I mean to say that in MRCP Part 2, you need to have a comprehensive study, starting from how the patient is presenting with the risk factors and the patient history, then going forward with the signs and symptom patient presenting. Then coming on, very important is the investigation, which is a very favorite topic for MRCP Part 2. Very favorite topic. Again and again, they keep on asking next investigation and the best investigation. And then is after the investigation is the treatment, initial and the best. And the after treatment can be the question of prognosis, right? What is the prognosis in a COPD patient? So now these are the some set of questions which have been repeatedly asked in the examination. They just keep molding the kind of question, right? Okay. Now, moving forward to our second, which is very, again, important, is changing trends in the recent MRCP Part 2 exam diets. And they keep updating their pattern, and they keep changing the pattern, right? The exam, which just happened recently on 11th September, there were many changes in that, and I'll be just enumerating that. First is now they are focusing more on clinical application. If you have worked in your hospital, right, you have seen the patient, how to actually manage it. This is what they are focusing more on. Nowadays, they don't ask questions about the factual things, or you can say the things which you need to ratify or you need to cram. They are asking questions and they are relating different units, right? So that is another change, I mean, which they have done, that emphasizing on multidisciplinary knowledge. Let's say a patient, as I gave an example, patient having a history of CAD, a cardiology, right? And intermixing with the patient presenting with the respiratory symptoms, or maybe you can say the patient presented with a dark color of urine, right? So they are mixing the cardiology with nephrology and pulmonology. So you need to have that, and this is very much required for your clinical practice. And hence that is why MRCP journey itself is said that, yeah, if you go through this journey, definitely you'll not be just cracking examination and getting that MRCP with you. It's about being the best physician. And I believe everyone have that goal or that dream, that with MRCP, whether you want to work in the NHS or not, you will be definitely will be having that kind of confidence of having differential diagnosis and managing your patients in a better way. And that, I believe, is the main thing, right? Managing our patients in the best possible manner, and not just going with references. Let's say giving a reference to the neurologist or pulmonologist or cardiologist. If let's say you have interest in cardio, right, and you don't know much about neurology, at least you should be knowing the basics. If at all a CT is provided to you, you should not have that kind of dilemma, whether this is SOL or whether it is a bleed or whatever it is, right? Or let's say there is any kind of tumor. So you need to have a basic idea, and that is what is being provided with while preparing for MRCP, right? Even some other images for which are very essential to be known, as let's say for MRI. Even though you are not a neurologist, but at least you need to know this is how it looks like. And this is what is DWI. This is what is ADC. This is what is FLAIR image, which I have discussed in a neurology session of MRC Part 2 course as well, right? So basic idea, so that you do not miss the essential thing, that is a stroke, right? You need to know that patient right now, although you don't have an idea about the window period, patient have not given a history, there was a wake-up stroke, you need to have an idea that still patient is in window period because of that interpretation of your MRI, right? The ADC and the DWI, which are very essential. If you know it, then you know that, I mean, let's say patient don't give you a history and patient doesn't know whether, I mean, he just woke up at 6 a.m. and he has one side paralysis, right? And you don't know what happened, when it happened. Had it happened at 5 a.m. in the morning or 4:30, or maybe at when he just slept at 10 p.m. in the night. So you don't know, and those are called as wake-up stroke. So you need to know that, yeah, the first thing is you need to get a CT, ruling out any kind of stroke, then going forward with MRI. With that kind of MRI, you need to have an interpretation using the DWI, ADC, and the FLAIR images. And I believe, and I know that you all might be knowing it. If not, do not panic. Do not have that anxiety. I'm the person who do not know it. It's not like that, right? We are here to learn, and every day we keep learning, and that is the fun of medicine, right? And that is I and many of you who are going with MRCP Part 2 might be loving medicine, right? I'm in total love with medicine. And I believe so do you. Okay, the next thing is rise in image-based questions. In the recent night, on the 11th September, there was a tremendous rise in the image base. Previously, what they were asking were 20 questions out of, I mean, around 10, 12 questions out of 100 questions, right? But this time they have gone further to increasing the image-based question to 20 to 22 in just 100 questions, right? And in totality, if you talk about the whole day, it was 40 to 45 questions. So they have increased, and this is what they keep on changing, right? And we need to be aware of the changing trends, that yeah, now they are changing the trend, they are increasing the image-based questions, and definitely it'll help you. And mind you, I have one question at the end of this session, end of this session, having that image also and a confusing question with the confusing options. So I believe you all will go through it and will come to the answer, to the correct answer, right? Okay. So fourth one is greater focus on the guidelines. And this is again, a very important point to be mentioned, that nowadays there are many changes in the guidelines, right? And we have to follow the evidence-based medicine. You cannot just go with your own made concepts or your senior made concepts, or you might have seen your senior or your colleague doing in the hospital, right? You cannot. You need to know, yeah, this is what is evidence, this is what is a recommendation in the guidelines. So you have to stick to the NICE guideline directly, right? And you need to be updated that, yeah, these are the recent changes in the NICE guidelines. As let's say I mentioned about, there's a recent change in the pneumothorax guidelines. I believe you all might be aware of. Again, don't have that anxiety or that panic thing, right? That I don't know it. It's absolutely okay. And that is why Pastors is here, right? To help you out with the recent guideline, the changes in the guidelines as well. And I'm there to help you out also, right? And the fifth is complex and nuanced question options. So for sure, the questions are complex, twisted, as well as the options provided. And hence, it becomes very difficult in the exam that how to go about. First of all, you have a lengthy stem of question, and then you have confusing options. So how to manage your time? And this is what I'll be discussing in next 5 minutes or so. The sixth point I would say is increased focus on emergency and acute care. And this is what I am seeing for the past 5, 6 diets, that they are increasing the number of questions which includes emergency scenarios. It can be cardiac tamponade, it can be MI, it can be stroke, it can be your pneumothorax, all these emergency scenarios, or let's say the cardiac arrest scenarios, right? Patient having ventricular fibrillation, patient having ventricular tachycardia, right? And that too pulseless one, or patient having a shock condition, patient having anaphylactic shock. So there is a recent change in the trend, and they are focusing more on this emergency and the acute care. So you have to pay attention. And this is what I mentioned earlier, that they are focusing more on the fact that yes, if you are working in the niches and taking you as ST2 or ST3 trainee, then yes, you need to be aware of at least these emergency scenarios where you need to know when to push that alarm, that yeah, this is an alarming condition. So you need to be aware of that. Okay, then the another important thing about our session, about this webinar, is time management strategies. And this is what I was talking about, that yes, definitely you need to read question in an effective manner, right? You need not to skip the theory or the stem being provided, but as well as you need to manage your time. Now, how to? I mean, you'll be like, if we have to go with the whole of the question, we have to go with the whole of the investigation with a confusing option and ruling out the options, then obviously it'll take much of our time, right, in the exam. And this is one of the many challenges in MRCP examination, and which people or the candidates, they face major problem with this one, having the time management. And they, in the last few minutes, they just rush through the question. They just rush through, right? In a matter of just 15 minutes or so, people have the habit of going with 20 questions. Obviously, that is again a no to it. And that is a suicidal thing, that you have spent 2 hours or 2.5 hours on 80 questions, and the last few questions, I mean 20-25 questions, you are just giving 10 minutes, right? So it's not done, and definitely it'll hamper your marks in the examination, and it'll not be a good result for you, right? So again, very importantly, is the time management as well. Now, how to go about it, how to manage that? The first thing is practice under exam condition. So whenever you are preparing, right? And I believe you all might be going with the past test question bank, which is, I believe, is a standard one. When I cleared my examination, whether it was part one, whether it was part two, it was past test, right? And it's not because now I'm the course director and they have offered me this course director. It's previous to that also, I just went ahead with past test, right? So anyhow, the kind of questions provided in the question bank is just amazing, right? The twisted ones. And this is what is needed for your part two. You do not have to go with the straightforward questions, which is not being asked nowadays. Now, whenever you are practicing your question, which is very essential, you need to have your time management. Always, let's say you sit, you have a time of let's say half an hour. Always time yourself that for half an hour I'll be attempting these many questions, right, as just like the exam, and then move forward. This will actually help you out to have that better reading, right? I'll not say faster reading, because whenever you go with just a word of faster reading, obviously you will be skipping many important clues hidden in the stem of the question. So effective reading, that should be effective as well as a faster reading. Yeah, you need to know that, yeah, this is how a patient presented, this is how the question started, and this is one of the clue I can think about, right? And then you relate with the investigation provided. And this is how you need to go ahead, right? And once you keep practicing these in a timed manner, definitely you'll develop that strategy, you'll develop that nature of managing your time in the actual examination also. So hence, do not just keep focusing on the theory and going forward reading the new articles. Yes, that is good, right? You need to enhance your knowledge. You need to go ahead learning many things, definitely, no doubt in that. But as well as whenever you are going and writing this kind of examination where you might get lengthy question, you need to respect time and you need to have that time management, right? Okay, and you cannot just spend 3 minutes on a question and going into those emotions and going in having that ego factor that I was working in cardiology or pulmonology, I cannot make this question wrong, or I cannot skip, or I cannot just go with the option, right? I need to be good, or I am very good in this particular unit, right? So do not go with those emotions, right? You need to, because in the examination, your emotion will not have any value. The question have value. Okay, the next point is how to go about the time management in the actual examination. You always need to have those checkpoints. And what I say is always break down into smaller chunks. Now, with that, we have 100 questions in a matter of 3 hours. And that comes out to be 180 minutes, 100 question. And that is spending around what they have given is 1.8 minutes to be very specific. And that doesn't include the last few minutes for the revision, right? That is the exact. So 1.8 is the average and that is the maximum. So you cannot, right? Now, with that, what I would say the maximum is 50 questions in 90 minutes. But that is the maximum. But what I believe and what I keep saying is just try completing 50 questions in a matter of 80 minutes, right? So 80 into 2 comes out to be 160. And hence, what you are left with is the time for your revision at the end. And if you still don't believe about 80, you further divide it, the 25 questions in a matter of 20 minutes, right? And after 20 minutes, just evaluate, have you completed those 25 questions or not? If not, you need to rush. You need to rush. Otherwise, you will be making those silly mistakes, which definitely you will be having a guilt or a regret after the examination that why I have not given time to this particular and this easy question and I have made a silly mistake, and which can obviously very lethal or I can say suicidal in the examination, right? You cannot afford to miss, or you cannot afford to mark a question which is a very easy one as incorrect, right? Okay, so always have those checkpoints, and when you keep practicing questions in that manner, definitely. Dr. Chirag, I can see your raised hand, so I'll take care about your query later, right? At the end of this webinar. Let me just go ahead. I totally believe and totally know that yeah, you might be having many questions in your mind, but let me just go through this, and after that, I'll take care about your queries. Is that okay with everyone? Is that okay? Okay, so third is don't dwell on difficult questions. This is what I just mentioned. That if a question is taking too long, let's say there's a cardiology question and you love cardiology, as I do, right? And there is a question about, there is a mention about the saturation. There is all the cardiac catheterization values, right? Having the changes in the pressure in the right atria, right ventricle pulmonary artery, then LA, LV, and you have to go through all the investigation, all of the history, and it is taking too much time of in the examination. Then again, put aside your emotions, right? Go ahead, just see the options being provided, go with a educated guess. And this is very important, right? You cannot have a wild guess, right? In the MRCP examination, and that too part two, you cannot have wild guess, right? You need to have a guess which is very thought of, right? You need to pay some attention which are with the options being provided, right? So educated guess. So you need to have that, yeah, this is the most closest I can think about, and just flag that question in the actual examination and then move forward. Because if you do not move forward and you spend 4 or 5 minutes in that particular question, again, you will be losing much time and you will be losing many easy questions. And hence, what I believe, what I have done, and what I keep advising is go with two pass. So first pass is you just go ahead with the easy question, just finishing it. And wherever you feel that the question is much twisted, the options are very close by, just go with the educated guess, whatever you are thinking about here. Let's say B option is correct or C option is correct. If their question is of infective endocarditis and they are asking about a empirical therapy, right? And you are confused what to go forward with, just mark the option which you believe might be correct and flag it and come back to it later on. Do not keep spending, do not keep thinking much in the actual examination, which is very essential, right? So the important point in the exam is you can review, you can flag those questions, and you can later on review. I believe you all know that, right? Those who have given part one, then all of you know it, right? Because now it's all an online examination. Previously, it was paper pencil examination. Okay. Next one, if I talk about, is again essential in the actual examination is save time for final review. And this is what I mentioned, that you need to have at least minimum of 10 to 15 minutes. The best would be having around 15-20 minutes. But if minimum of 10-15 minutes, so as to relieve your anxiety, first of all, that yeah, you have completed those 100 questions, because the first thing is decreasing your anxiety in the examination. And now going forward with those questions which you might have flagged, or you might have marked. Please review those. Some people just keep saying that once you have marked in the first go, those are the correct ones. I don't believe that. It's not like that is a gut feeling and something like that. Because sometimes you keep checking the clues which is provided in the question, and it just I mean come back to you that yeah, this is what they are talking about and this might be the correct one. So yes, I believe you need to have that time for the review. Now, so this is what the strategies you need to have, right? And also the next thing while you are preparing for your examination, I would like to say is very important is revision. You cannot just keep jumping on to different units that I have completed cardio, pulmo, neuro, all those units, right? You might have a proper schedule, and this is what you should go forward with. First of all, prepare a schedule for next 3 months or 6 months, whatever you are planning for. Let's say you have 6 months in front of you. Please prepare a schedule that, yeah, 1 week or 10 days I'll be allotting to neurology, 1 week or 10 days to cardiology, then pulmonology, and so on and so forth, right? You need to prepare, you need to have that proper schedule with you. And now please stick to it. When you have, let's say, completed those 10 days, out of let's say in neurology you have 300 question, and you are able to complete just 200, you are not able to complete your go with your goal, right? Whatever you have set. Now do not have that panic of those remaining 100, rather jump onto the next one, and after 3 or 4 units, please simultaneously keep covering your backlog. Do not just extend your time. Let's say in place of 10 days, do not go with 15 days of neurology. No, it is not. Rather, start another unit, which you might have planned, you might have in your schedule, then keep clearing the backlog. And simultaneously, after 3 4 weeks, keep revising what you have read, because that is more important rather than jumping on to the different units or different question banks. Many people, they have this doubt. I have completed, let's say, past test. What next? Should I go and purchase or subscribe to the another question bank? Should I go ahead with that? No, it's not about going with different and new questions again and again and analyzing your. But yes, very important is whatever you have read, at least minimum of 2 revisions are essential, which I believe you might have gone through for your part one also. And that is why you have cleared it, right? Okay. So now, the next thing is a very interesting one, is a question which I want all of you to read, right? I'll be just waiting for 45 seconds or 50 seconds for this particular question, right? I want all of you to go through. And again, I would say that whatever questions you have, you can post to the pastors team. Later on, I can reply, or maybe after this webinar, right? But I'll take care about your queries. Don't worry. Okay. Now, so the next, are you all ready? Can I have yes or thumbs up in the chat box? Can I have that? And then I'll just, can I have I have just seen 10, 15, 20. Keep coming, keep coming. Yes. Yeah, I can see you all are motivated and energized and having that thing that, yes, let's go on with the question. And okay, I can see many, many hands and many, many yes. Okay, I'm so glad to see that. Thank you so much. Okay, now we'll go ahead with the question. Please read this question. Take your time. 50 seconds is there and come up with the answer. I can see many of you are writing the option C as the correct one. Okay. It's because every other person is writing C and you are also going with the same, or what? Okay, and now I can see E option, A option. Okay, okay, okay. Can I have other answers? And let me tell you, C is not the correct one. Okay, now I can see D, D, A, E. Okay, so C is ruled out. Now you are left with four options, right? Okay, A. Now it's hemorrhage. If not abscess, this seems to be a hemorrhage to many. Okay, so happy to see your responses. And your interaction, this is what I love, that yeah, you need to interact, you need to answer, you cannot be shy, you cannot have that kind of nature or introvert nature, sitting back and listening to others and seeing what others are answering. No, you have to have your opinion. If this kind of patient comes to you in your hospital, in your OPD, obviously you need to have your opinion. You cannot keep waiting and you cannot keep asking what other doctors mention or what other doctor have made the diagnosis. You have to take that call by yourself. Or you are a kind of person, you'll just call up your consultant, sir, I have a patient, please look at it. No, you do not. Now you are going forward with MRCP. You are a person, you are a doctor who have to take a call, diagnose, and go ahead with management. Whether, let's say you have your consultant, yes, they are there to help you and support you. But if you come by yourself that, yeah, this is what, sir, I feel might be the reason, this might be the diagnosis, and this is how we need to go ahead with this kind of management. Obviously, that person, that your consultant will be the happiest person, right? That yes, you are doing what is required. And this is what I used to also believe and I used to do, right? As mentioned on past test also, I was made the youngest consultant and the ICU head at Apollo Hospital, Delhi, right? But I mean, again, my nature was also that, yeah, you need to have a backup and you need to take that step. Yeah, this is the kind of thing you are thinking about, and take a step. You cannot keep just thinking about it, right? Okay, now I believe around more than 100 responses over here. So I'm so happy to have those responses. Now, let's go with this particular question. First of all, the image is being provided, right? And that is what I kept saying is, this can be misleading, right? It can, at a first glance, yes, you might say seems to be a abscess or a hemorrhage, right? Which you can see on a CT, right? Now, let's start with this question. A 20-year-old man admitted with a flare of ulcerative colitis and treated with intravenous hydrocortisone. About 24 hours following admission, he becomes increasingly drowsy. His GCS drops to 8 and temperature is 37.5 degrees Celsius. First of all, if there's abscess, temperature is relatively very less. 37.5 degree is not a good one, right? It doesn't give a good feeling to have a differential diagnosis of abscess as the first one with a temperature of 37.5. I'm not happy to see that, right? I was there in the neuro ICU in Apollo, heading that department, and 37.5, never. I mean, whenever there's an abscess patient, obviously they are very much febrile, around 38.5 or 39 or more than 39 degrees Celsius. Anyhow, the next thing what the question mentioned is there's a bilateral papilledema, right, which suggests there's increased intracranial pressure, ICT or ICP. He's flexing all his limbs to the painful stimuli. All his tendon reflexes are present and symmetrical. And now comes the important line. Both plantar reflexes are extensor. Now can you think about having abscess in one of the lobe, which is obviously on the left side being shown in the CT scan, and having both extensor as a both plantar as extensors. Extensor mean obviously there's a UM in pathology, right? And now with that, if let's say it's a bleed or you are thinking about abscess, both of them are localized to one lobe, which is a left lobe. The presentation or the extensor plantar should be on the right side. But over here, what is being mentioned is both plantar reflexes are extensor. And this is what they have twisted. Further, what they have mentioned is he subsequently has a generalized seizures and is intubated and ventilated. His blood tests are, these are the ones which are provided. And this is what I'm saying is, if you know what you are going forward with, you will tend to skip at this moment Just thinking about, let's say you have abscess in your mind as a differential, you will just see the ESR and the CRP. Yes, whether it is elevated or not. Yes, it is elevated, right? Now, what they have mentioned further is CT head with contrast. Why will they provide a CT head with contrast, right? CT head with contrast is done only for few pathologies. If it would have been the bleed, they would have done NCCT, and that is what they might have provided. Now, with this kind, can you rectify your answer now? Now I'll just open my messages in chat box. Wait a minute. Uh, D. Okay, now I believe you are able to understand what I'm saying. D is found due to bilateral. Okay, good, perfect, perfect. Papilledema, good. Now I believe you are able to. Yes. D, yes. So this is what I feel is required when you are reading your theory, approaching your question or practicing your question, and managing your patient. Do not have that goal in front of you, just one goal that, yeah, I need to clear. Yes, that is one of the short-term goal. But the long-term goal is to be a physician, a good physician, and helping and managing your patients in a better and effective way. That should be the goal. And whenever you are practicing question, always think, if that sort of a patient comes to me in my hospital or in my OPD, this is what I going to be having a differential diagnosis, and this is the way I will manage, or these are the investigation I'll order. If you are relating these things while practicing the question and always thinking that, yes, if this sort of patient comes, this is what I will look forward, right? Or this might be, wait a minute, sorry. Okay, wait a minute. So this might be the differential diagnosis, and these can be the other reasons, then yes, that is what is required. And hence, that is the best part about this MRCP journey. Now, with that, as I believe most of you might have got the clue that with that, bilateral papilledema and also plantar reflexes, both are extensor, then yes, what they are talking about with the CT contrast is you need to look for this area. I believe you are able to see my cursor, right? So this area, this is called as empty delta sign, which is very pathognomic and characteristic about sinus thrombosis. So cerebral sinus thrombosis, very essential, very important. Now, why this patient? In the very first line, what they have mentioned is patient having ulcerative colitis, which is a prothrombotic condition. And hence, with that prothrombotic, it can be any other, let's say patient on OCPs or patient having any other prothrombotic condition, protein C deficiency, protein S deficiency, then yes, again, that is a risk factor being mentioned in the very first line. And this is what I'm saying. Always pay attention how it started, the age, the occupation, and the background. And then thinking about this is the presenting complaint. Obviously, that requires much time. Simultaneously, this is why I mentioned whenever you are practicing, always have those timed mock or timed question. Do not have that habit that, yeah, you are just going here today, I need to complete 20 questions or 30 questions. No, always time yourself. And then maybe after that, once you have done 15 questions or 25 questions, whatever the goal you might have set, now go ahead with the explanation that why you are not able to answer this particular question, right? Okay, now, these are the kind of, and this is, I say this question was there in one of the previous diets, right? So I have not taken and I have not framed by myself. This is one of the type of question which was asked in the previous diet, right? And this is what I have included in majority of my videos, right? And I mean, we have this course on past test, MRCP Part 2 online course, and that is called as Exam Essentials, which is obviously very essential for your preparation, where we have 29 theory recorded sessions, right? 29 having all neurology, pulmonology, cardiology, and talking about the topic, full topic, which you need to know. It's not about just a basic that this is the answer and you just go ahead with that. We need to have that discussion. Why venous thrombosis and what are the risk factor, how the patient can present. And these are the things, right? Patient presenting with in this manner, presenting with seizures, drowsiness, and all those things, right? So you need to have, if you don't have a basic knowledge, you don't know about the theory, obviously you'll not be able to have that differential diagnosis. So this is what I have discussed in those videos and the pastors platform. where we have included all the radiology images, X-rays, CT scans, MRIs, ECGs, very, very essential, right? Nowadays, in the recent 11th September, there are many, many questions. If some of you might have given this examination, there were many ECGs asked in the 11th September diet. So again, I would say that please keep practicing and keep knowing. And also you need to know where to focus. Some people, they just keep going ahead, right? Without any strategy, without knowing what is being asked in the examination. You cannot have that wide thing, right? You need to somehow, you need to limit yourself that, yeah, these are the things which are essential, which I need to know before going to the examination, and not for the examination. I would say for your clinical practice also. You need to know how a cardiac tamponade ECG looks like, how a pericarditis looks like, how a complete heart block looks like on ECG, right? So again, and this is what I have discussed in all these sessions, right? About the different type of ECG which are very essential for the exam, right? And finally, next what I have in this course is the Q&As. This is one of the questions I have taken, right? And which are very essential. So Q&As where I have 1 hour discussion, how the question is, how to approach, how to check, these are the clues being mentioned, and how to correlate the things, which is essential, right? You cannot be having one set of mind that, yeah, this is what I am looking forward, this is a hemorrhage and answer is hemorrhage, ICH. No, you have to know the other options also, right? Okay, and this is the segregation of the units, right? Which I have gone through with this course, the part 2 course, right? The neurology, cardiology, all these 10 units, right? Which are again essential. Nephrology session is being taken by esteemed Professor Kalra, who I love, right? He's a very renowned nephrologist. I don't need to mention much, right? You might have read, you might have gone through his book as well. And then the pharma, psychiatry, derma, and ophtha by Dr. Beg, and all the other sessions have been recorded by myself, right? So talking about the basic of neurology, which you need to know, what are the tracks, let's say the ascending and descending, why Brown sequence is presenting in this manner, right? Whenever there's a hemitransaction, or you can say the question of transverse myelitis, why this is happening, why patient is presenting in that manner, or as the first investigation or the next investigation, right? So you need to know those things, and this is what I have discussed in this particular course, and those are the recorded sessions. And obviously that has the flexibility that whenever you have the time, you have that availability, you can go ahead, right? You can see it again and again. So, and for all those who are there in this webinar, I'm so thankful and grateful to all of you. And there's a surprise gift for everyone who has shown up in this webinar. And I believe, Lisa, are you there? Lisa or Jenny, are you there? They might share the link for today, and we are giving a 25%
Yeah. Hi, Chirag. I've put the link on the discount course in the chat box for everybody. So grab it while you can, 25% off until Sunday, and then the offer obviously closes and it reduces. So yeah, put the link in the chat. So if you want me to repost it, I can do. But yeah, hope you found everything well, guys.
Okay, great. So that is still Sunday, and you have been provided 25%. I believe that has never been given before, right? And already many doctors have taken this course, part 1 course. Many of you might have taken my part 1 course on past test as well, right? And might have seen how I explain things, how I discuss things. Anyhow, so this part 2 course is again very essential for your exam, and hence the name part 2 essential course. And this is a very limited, the time limited offer, right? Again, we need to respect time. So 25%, just go and grab it if you are going with the next exam. And these are the 3 pillars which I believe is for success. The first thing is you need to have that determination that, yeah, I need to crack this examination. You cannot be just going ahead for the sake of it, that I have just registered and go forward and see how it goes, how what happens, or I'll just go with my guesswork, I'm very good at guesswork. No, it is a very, I believe, a very short-term goal, right? Again, your long-term goal is to be a good physician and a best physician. So you need to be determined that, yeah, I need to go ahead, this is one of my goal, I need to have that, I need to achieve that. Second, it's not just the hard work, it's the smarter hard work. You need to know where to emphasize, where to focus, where to utilize, where to put your energy, right? We have a limited time. I know we all are busy in our clinical schedule, and also we have our social life, right? You cannot be having the question bank all time in front of you, right? You cannot be that kind of a person. If you are, I'm so happy. But I say, and what I believe is you need to work in a smarter way. You cannot be just doing the hard work, sitting for 10, 12 hours and just reading everything which is given in the books and reference books and the new guidelines and everything on the internet, right? There is infinite information on the internet right now, right? The era in which we are. So you cannot have just the hard work. You need to have hard work in a smarter way. That, yeah, this is what is required for this examination, and this will help in my future in my clinical management or the clinical practice, right? So smart prefix is very important. So you need to work smartly, and hence this course is, right? So this course gives you that smarter way that, yeah, these are the essential things you need to know before your examination. You cannot avoid, you cannot skip. At least those are the minimum. And also, what are the concepts behind that? You cannot be just cramming everything which is given in your question bank, right? And then having that strategy, that these are the strategy, this is the schedule, and then going forward with repeated revisions. And then this is the best phrase, I believe, right? This is what I love, which I keep saying, keep advising, and keep believing by myself, that if you got a dream, you gotta protect it. You are the person who has to protect it. And people, they keep saying, right? They keep saying some things to you. So if they have not done themselves, then yes, they keep saying you cannot do it. And don't let anyone tell you that, yeah, you cannot do it. It is, everything is achievable if you are determined, right? And you have to achieve that dream. So that is what it is. And thank you so much for being there in this webinar, uh, attending this webinar. And I'm so happy that you all are there and you were interacting with the questions and everything. And I believe this session might have helped you. This so it might have. Can you mute yourself? I can hear some
Hi,
voices.
we have a couple of questions, Chirag. Would you be able to answer them if I allow them to speak?
Yeah. Yes. Go ahead.
Mohammed, I'm just going to put you on if you're ready to ask your question. Mohammed,
Yeah,
want to unmute yourself?
Hello? Hello? Can anyone hear me?
yeah.
Okay.
I can hear you.
Doctor, thank
Good
you so
evening,
much
Dr. Tahir.
for a very
Yeah,
detailed advice.
most welcome. Most
I'm,
welcome.
I'm, I'm preparing for the MRCP Part 2 Ireland. So all these
Okay.
things will, will also apply on that one. Secondly, regarding that CT scan. So if it was a sinus thrombosis, why there is a focal, lesion there? Just
Hmm.
my two questions. Thank you.
Okay. Very, very good. I'm so happy that you have come forward with this. And I have answered that in this again, the past course. So
Sorry, I
I
didn't heard
go
it.
ahead. So I'm so happy. I'm so happy that you have come ahead with that. Why there is a localized hemorrhage sort of thing which is there.
Yes.
So
Yes.
first of all, I'd like to answer your question on this clinical thing, right? Because I love that. Now, the question, if we talk about, there is a sinus thrombosis, and patient has a prothrombotic condition, which is ulcerative colitis, right?
Right.
Now that what might have had is an initially ischemic infarct. And these are the patients who are very at a high risk of developing hemorrhagic conversion in that infarcted area. And this
Okay.
is the possibility and very common thing to be seen in all these prothrombotic patients or
So
patients.
we have two diagnoses, right?
Exactly. So that is a complication. That the hemorrhage which you are seeing is a complication of what is a sinus thrombosis. So initially, sinus thrombosis happened. With that, there might be an infarct which might have led to the hemorrhage. But
Right.
again, crux was patient having bilateral plantars as extensor. It cannot be just possible with one side of hemorrhage. Is that okay with you?
Thank you. Thank you so much.
Most welcome. And now answering your second question about MRCPI, Ireland, the syllabus is almost the same. The questions asked is almost the same. The topics are almost the same, right? It is
Right.
just a matter of a different examination. Yes, there's a difference in the PACES examination about the time allotment, but Part 1, part 2, it is almost the same.
Thank you. Thank you so much.
Most welcome. Most welcome. My pleasure. Any other question? Any other thing you need to discuss or your feedback, whatever you want to have a word? I have next 10 minutes. Yeah.
Dr. Jamshed, have you got a question for Dr. Chirag?
Yes. Go ahead, Dr. Mumtaz, Dr. Jamshed Mumtaz. Hi, good evening. You need to unmute yourself, Dr. Jamshed. I can't hear you. So regarding, I can see some queries about the course. I believe Lisa or Jenny, they'll help you with all these queries. The how much is the excess and whatever the course duration and all those things. They'll help you out with those queries. Right, Jenny? Jenny or Lisa, are you there?
We are there. We are here, Chirag.
So yeah. So you can ask them, and I believe you can give your number or something like that, or they can mail you. Then we can answer those queries, I believe. Regarding the
Well, we have an email address. I'll put it in the chat box before we
Yeah,
end. And if you've got any queries about the course, feel free to message us and we'll respond as quickly as possible. But
yes,
yes,
yeah.
it's all right. And we've just got one more question, if that's okay, from Lynette. Lynette, do you want to unmute yourself and hopefully ask Dr. Chirag a question?
Yes, go ahead, Leonard. Hi, good evening. You need to unmute yourself, Dr. Lynette.
Lynette, are you there? Hi.
Yeah, you're audible. Hi.
My question is, how long would you advise one to study before registering for the examination after taking the course?
Okay, after taking a course, they go again. This is a very subjective question, and it depends upon person to person. Your preparation, your basics, and how much are you investing? I mean, I'm talking about the efforts. How much efforts have you invested in your preparation? Now, it might vary, and this is a very frequently asked question, and that is why I had the smile while you were going with the question, right? That how much time we need to crack this examination, or how many hours we need to sit for this examination, right? Now, again, that varies. If you are determined and if you have, let's say, gone with this whole course, I believe to revise what is there, right? If you have gone through, you might take around 2 months or so. And in the next last 15 days, 20 days, you need to keep yourself free for revising. And again, it depends. If you are taking out around 4 or 5 hours per day, you will be able to do it in a matter of just few days, right? In a matter of, let's say, 25 days or 20 days, if I'm not wrong, right? Then you need another revision. What is being taught, what is being discussed in the session, again, those, and simultaneously you keep practicing. It's not about just the course, just listening to the theory, the concepts which have been discussed, and I have discussed the Q&As, the questions also, but simultaneously you need to keep practicing questions from your past question bank, which I believe is the must, right? So, and in your part 2, there are not many questions, right? Whereas if you talk about the part 1, we have 4,500 or 5,000 questions, right, in our question bank. Whereas in part 2, you have just 2,500 to 3,000 questions. Those are not much, and you don't have to go much back into that theory. Obviously, if you are going with this course, you are getting all the theory which is required, the majority of it, right? Does that sound good, Dr. Leonard?
Yes, very much so. Thank you so much.
Okay, most welcome. My pleasure. Okay, so I believe now
I think that's it for questions now, Chirag. I think we should wrap it up if that's okay with you and everybody else.
Yeah, I guess, yes, we can go ahead with, I mean, concluding this session, this webinar, and whatever question comes to you on mail, you can share with me. I'll be happy to answer that, right?
Thank you, Chirag. Yeah, of course. And I've just put the email in the chat box. So if everyone has any questions, any concerns or any issues or anything you want to know about the course, please send us an email and we'll be happy to respond.
And please don't forget and don't waste your time just thinking and procrastinating whether we should go ahead with or not. I believe it is about the knowledge, grabbing knowledge and having that knowledge. It's not about whether this course is good or whether we should go with MRCP part 2 or not and keep delaying and keep procrastinating. No, you need to take a step. You need to go ahead. You cannot keep waiting. Every day our responsibilities, our commitments keeps increasing. There will no perfect day or perfect time or perfect diet that, yeah, let's say in August, you will be having that thing that I am very perfectly done. I have done everything which is required. That time will never come, right? You can go ahead with imperfection, but yes, please go ahead with smart hard work, and that too in an effective manner. Definitely, you all will be able to crack your examination. Okay, and keep believing yourself and be determined. Bye-bye. Take care. See you. Good night to all of you.